hospital is located in Rhode Island. It's a 359-bed community hospital, kind of in the center of the state. We have a great mix, but we have a high amount of older adults in the state of Rhode Island, which is really projected to continue to increase over the next several years. I think caring for older adults has really been important to us, both at Kent and as part of our healthcare system. About 30% of the volume that comes to our operating room is through the emergency department. A lot of hip fractures, and really understanding how we could really provide better care for our patients. I'm at Kent Hospital, and we thought the GSV program would really help to elevate the level of care for all of the patients in the hospital. When I see a patient, first, we're able to identify them and really figure out what matters most. That's really strongly built that into our program. And then as we go through our screens, if they screen positive or something, be able to be proactive and take steps in advance. Whether that's referring them to our VNA for a home visit before they're coming in, sending them to our palliative care team to discuss their advanced directives and making sure that we're clarifying those pieces, but being able to take those things in advance and be able to set them up, and then using our multidisciplinary conference to really think about how are we going to touch that patient when they come into the hospital. And then I think on the flip side, when you're coming in through the emergency department, we don't have that long lead time to get ready. And so how can we then kind of in a fast forward approach really manage those patients? And what we found, it's a really strong collaboration between surgery, our hospitalist team, and our geriatric team, and our nursing team. And really kind of coming all at once and being able to, how can we now manage this patient through this acute event, but still think about what matters most and the rest of the 4Ms kind of in that management strategy. We've changed from more a procedure-based kind of problem. It's really thinking about managing the whole patient and what's most important. It's really shifting kind of how we think about, particularly as a surgeon. But I really think it's much more impactful, and I think it builds better relationships with our patients, and it really helps both the patient and the family understand what's coming, and then how do we then navigate other things that come up, always keeping in mind that lens of what matters most.